This is a podcast from the Nuffield Department of Medicine. Dr. B. Wee tells us about palliative care in Oxford and her research on end-of-life care and fatigue. Hi B.
Hello.
What is palliative care?
Well, palliative care is the care of people who have advanced progressive disease, a life-limiting disease, where we look at their physical, psychological, social and spiritual aspects of how that affects them and try to improve the quality of life for what there is left of their lives.
Is palliative care different today than 5 or 10 years ago?
Yes, when palliative care first started, it was very much focusing on terminal care, if you like, the last few weeks of life. Then we got better at doing that, and now we're involved at an earlier stage. But in the last 5-10 years, a lot of the patients that we look after, a lot of them are cancer related. And of course, cancer has become a much more chronic disease. People are living longer with it, but with symptoms and with psychological effects from it. And also, we are becoming much more involved in people with non-cancer disease, so people with heart failure, with advanced chest diseases, with liver disease, with neurological disease like multiple sclerosis and Parkinson's and so on. So we're involved with basically anybody who's in perhaps their last year or years of life.
What is the Sobell Study Centre?
Well, Sobell Study Centre is the education and research arm of Sir Michael Sobell House, which is based on the Churchill Hospital site. And Sobell House itself is a specialist palliative care service that provides beds for patients who have those specialist palliative care needs, from which we also have teams going out into the community and into the hospital to support patients. And the study centre provides the hub for education and research into palliative care.
What are the major lines of research in palliative care?
Two particular areas where Oxford is concerned. One is in end-of-life care, so the experiences of people at the very end stage. But the other bigger area now is actually in fatigue.
What is fatigue?
Fatigue is the utter exhaustion that we've all experienced. The difference is with this group of people, when they have had a rest, it doesn't change that experience of fatigue, unlike you or I who will feel rested after we've had a good night's sleep, for instance.
Why does your line of research matter and why should we put money into it?
Well, firstly, fatigue is a very common problem. So if we think that in the last year we have something like 500,000 people died in England in the last year, of whom a large proportion would have been living with disease for the last year of their life. And fatigue is as common as anything up to 75% in people with cancer. If they're having chemotherapy and radiotherapy, is greater than that again. Again, about 60 to 80% of people with heart failure, same again in chest diseases, would suffer from fatigue. If I explain that one of the patients I saw yesterday was a gentleman who had advanced liver disease. And he has been trying to live a normal life, went up to visit his son at the weekend, and I would like to quote to you, he said to me, "I felt very, very tired. I couldn't keep awake. And when I went to bed, I couldn't sleep at all. And during the daytime, it was as if a cloud had come over me. I had to close my eyes and just fall asleep. I've got no energy. Energy's completely sapped from me. I can't walk properly. I want to walk, and I can do it with a stick, but very, very slowly, and I am shattered at the end of that." Unlike you or I, we get fatigue, we go to bed, we get up and we're rested. People with advanced disease don't. So it's a very common problem and we don't have a lot of good ways of handling it.
How does your research fit into translational medicine within the department?
Well, it's very much at the bedside. We've got two projects going at the moment. One is a drug trial to try and have a very simple, inexpensive drug to try and improve fatigue in these patients. We also have a behavioural management, so with the help of an occupational therapist, helping patients to find ways of managing the physical and the psychological and the emotional impact of fatigue on their lives. So that's, if you like, at the bedside bit of it. But we're also interested in finding out the point at which fatigue becomes irreversible and see if we can come up with some ways of stopping it from becoming irreversible. So unlike our usual bench to bedside, perhaps we're looking at bedside to bench here.
Thank you, Bea.